patient that has acute pancreatitis, because guess what? They always do give you NG2. Okay? And not only will we be placing the NG2, but we're probably pushing it to wall suction, which is mounted over there for us. So we can point to the suction now, the canister on the wall, but we cannot connect it because there's not the adapter to connect. The NG tube has a little white plastic connector to the wall tubing that allows you to connect the tube to the wall suction tubing, and it sucks out in the canister. Okay? But now we got to gather our supplies. We know it's going to be the wall suction. We've got this. We know it in the bedside. It's already set up. We don't have to do that. So here's our NG. It would come in a package. Okay. We know we got to have paper tape because we got to secure it, and we're going to measure it. This is going to be our measure mark, and it's going to be our secure mark. Okay. We got that. We have. Oh, look at this rubber band. I can't believe none of you ducked.
I've got a 3-year-old nothing stage.
And we have our, this is not fictitious. We always have, they're a little larger safety pins, but we will safety pin an NG to their gown. Sometimes it may be by just taking a piece of tape instead of a piece of, and just folding it over the tube and then sticking this when it's doubled, stick the pin through the tape to the gown. If you don't have rubber bands in your stock, this is what you use, is the Leucopore tape. You just fold it over the tube and put your pin through the tape, not through the tube.
Probably don't put it through the patient.
So would you please hand me that little bucket right there? This, we also have, because this is, and I'd have a little litmus strip in here, because that's the conformational test by evidence-based practice today. It's in your checklist, okay? But so we have that, we have this, we have our litmus strip. Now, before I don my gloves, I'm gonna split this tape like that far, right there. And what they say, split it down. In Leucopore tape, that's why we're using it. This is all we use for NGs, is this tape. This kind of tape, you won't see it any different. I would stick it on my bedside cart, but in this case, here's my bedside right there, okay? I would don my gloves, since this is real. We're gonna make it real. Don my gloves. Now I'm prepped and ready. I got my supplies. I'm going at the bedside. What have I done? The first 7 things. What have I done?
Check right patient identifiers, lock bed, rails,
precaution.
Rails up. Safety. How about raise my bed to a comfortable working height? I've also provided privacy. Okay? And now I've donned hand hygiene and donned gloves.
Is this a sterile procedure or just?
No, it's clean. It's a clean procedure. These are just normal gloves, disposable gloves, okay? Because when we start to insert, we don't know if it might gag and throw up a little bit. You better be prepared, okay? I would even have a little emesis, the little round green ones, the little you punch down and they open up. I'd have that next to me too. But this is all we used to have. They'd just throw open this and guess where it would go? Out there. So anyway, so now my little, I'm going to keep this good. So now I'm going to prep this. I've got my cup of water here at the bedside ready with a straw. It makes it easier to just take little gulps, little sips to gulp, okay, with a straw. Plus it keeps it away from their nose so we can actually insert a tube, okay? So I've got everything ready. I'm going to instruct my patient what we're going to do. We're going to place the tube down your nose into your belly, okay, to rest your belly, okay? So I'm going to lubricate my NG tube with hydrogel, lubricant jelly for mannequin use. And notice how I've already just rolled it up in my hand. I habitually do that. Oh, pardon me. Wipe the lube off. We've got to measure how far to put the NG.
Okay.
The tip of the nose the tip of the nose to the bottom of the ear. Are we there? Is that the bottom of the ear? To the xiphoid process, right there. The xiphoid process of the sternum. That's our mark. Okay. I would either use a pen or I'd use a little piece of tape, and I would mark that spot. Since I've got a little piece of tape right here, I'm just going to mark my spot just like that. I'm just going to put that piece of just like there to mark my spot. Okay. Now we'll lube again because we're going through the nose. Okay. All right. Would you please sit up really tall for me because I'm going to have you sip as we insert this into your tube. So get the water close as I gradually just insert. Okay. Would you take a little sip? Where are my fingers at, everybody? Where are my fingers and where is my tube? It's on the bed. If they were holding the cup, I would still have this in my hand right here to help guide that. And they'd be, take a little gulp. Oh, we're hitting resistance. So we come back a little bit and say, what's the deal? We're getting a little resistance. Okay, take a little gulp. Little gulp. Notice I'm advancing how far with every gulp? Just about an inch. Gulp. And gulp. Now they're not coughing and choking. I know I'm past the back of the pharynx. So now I'll just advance slowly. If there's no coughing or choking, I think, oh, I'm pretty good. I'm getting close to my mark. I must be getting down there close. Okay, I've met my mark. Okay. I don't know if I'm in there, but now I'm going to grab my syringe and aspirate gastric contents. Small amount. Put it in my bowl with my litmus strip and just test to see if it's acidic. If it changes the litmus, it's gastric content. It's confirmation the tube is in the stomach. That's evidence-based practice. Some hospitals will go one step further. Before it's used, they will do a portable chest x-ray. Okay. A little extra expense, but they do it. They still don't go just with this. So, okay. Now, there's a couple steps because I didn't have my pen light, but I want you to know we got this marked, but if you had problems or resistance going up a nose, you would pull it out and say which septum is the better septum to try to insert in the nose. And then if you had resistance, you felt really, after pulling back, you had continual resistance, you would put your pen light on there, open their mouth and see if the tube is rolling up in the back of their throat. If you still feel resistance, they're not coughing, they're just kind of gagging against it, but not coughing, and you're still advancing, it's just rolling up. It's not going down, okay? So you'd have to just pull it all back and gradually have them sip again until it passes the back of the pharynx. Once you're at the back of the pharynx and you get right down, it really, that's the half the battle in an NG is getting past that point, okay? So then we would, after we tested it, would confirm, then we would secure it with our tape, my tape right here. I'm gonna take that little piece off because we're where we need to be, okay? And then we would secure it. The sticky side is toward the patient, okay? I'm gonna put this part that's sticky. Oh man, I love these gloves. Up under the tube, and I'm gonna hold the tube with the sticky part right there, okay? That one comes over the patient, this side of the nose. This one comes this side of the nose, right here. And it kind of bends and then you kind of press that against the tube, not their nose. And if it's a little long right here, you just break the tape so it's not in their eye. You just pull the tape and have it just over their nose. So I pull the tape so it's not up in their eye. Okay? So then we would secure it with either this. You can just, put the tube around here. Remember, they'd have a gown on. If you use a rubber band, you just pull it through like that, each other. Then you put the pin, open this up, put the pin in, and then pin it with a little leverage so they can turn their head and not pull the NG out. So give them a little flex and then pin it to their gown with the rubber band, or like I said, get a piece of tape, fold it over, and use the tape and pin through the tape to their gown. Okay. Then if it's indicated, you connect to wall suction, which is typically indicated. Okay. Any questions? When we DC, don gloves, disconnect from wall suction. I have it just suction when I pull it out because just getting the secretions that are coming up, I want to suck them out. So I'll still have it to low suction as I withdraw and pull out. But you just basically say, okay, we're going to remove it now. Pull that tube out of your throat, and then we'll have I have little napkins right here, or a washcloth, or Kleenexes. Because when this comes out, gradually comes out, you're going to start getting secretions a little bit. It's going to be sucking just a little bit, okay? And it's going to be a little dipping, so I'm just going to fold it in my hand, keep it tight. I'm going to offer them a little either washcloth or some kind of Kleenex to blow or clean off their nose, okay? And then toss this in the regular trash. Okay, that's the DC part. Yeah.
So if you're trying to put it in there, just gagging, and you can't.
You
How
pull
many
back.
times would you attempt?
You pull back and ask them to sip a little bit more